My name's Graham Holder. I'm a junior doctor here at the hospital. The subject of my presentation today is hand transplants. I'm not a specialist in this area and I have no direct experience of it, but I've always found it fascinating and I'd like to share my interest in it with you. So, first of all, what is a hand transplant and why is it better than prostheses? Well, it's a type of a CTA, that's a composite tissue allotransplantation, in which skin, fat, muscle and nerve bone are all transferred from one person to another. To date, it's largely been used to treat patients with both functional and aesthetic deficits that can't be dealt with by conventional methods, but this is changing. The mainstay of treatment for amputated limbs has long been prostheses, but patients often reject them because they only provide limited mobility and function, and they can be uncomfortable. In theory, at least, transplanting a complete part should give much better results than even the most advanced prosthetic technology. So, more and more upper limb transplants are being performed around the world every year, and this is largely thanks to new and more powerful immune suppressive drugs. The strategies in use have been derived from the experience of transplanting organs, especially kidneys, and this has also informed the choice of drugs. Slightly higher amounts of immune suppression are used with a potent induction, followed by a low-dose maintenance regime. This regime can be supplemented by short courses of intensive therapy to overcome any episode of acute rejection. The survival rate of both patients and grafts under this regimen outperforms that for all other transplants. That's actually pretty impressive. At least one episode of rejection is recorded in 90% of cases, however, despite the immune suppressive protocol, and this is much higher than with kidney transplants. One reason for this is that hand transplantation represents a visible graft. That means you can make an immediate diagnosis of rejection based on minor changes in skin appearance, even though this has to be confirmed by a biopsy. If patients adhere to the regime, however, rejection is generally reversible. One of the challenges of hand transplantation is to achieve the delicate balance that prevents rejection, whilst at the same time protecting patients from the direct toxicity of the medicaments. But this seems to be working, and infection is actually the commonest complication. So, what happens during a hand transplant operation? It's a 6-hour procedure which involves 2 separate surgical teams, one removing the hand from the donor and the other working with the recipient. Bones are joined with titanium plates and screws. As with other bone grafts, they should eventually heal together, but the plates are left in to ensure stability. Surgeons then connect key muscles and tendons before tiny blood vessels are connected using surgical microscopes. 3 major nerves are then attached, followed by large and small veins. Once blood is circulating, the recipient begins to feel the new hand. A recent case attracted a lot of interest in the UK. It was a bilateral transplant for a man who'd lost both hands in an accident at work. Now, bilateral transplants aren't so uncommon, but what made the case particularly noteworthy was the fact that he still had both his thumbs, but not the rest of his hands. So it wasn't a transplant performed at the wrist, as is usually the case, but in the substance of both hands. Nonetheless, immediately afterwards, he managed to gain some movement in his donor hands, and has since improved dramatically. Indeed, just 9 months after the procedure, he was able to write a thank you letter to the surgeon. His recovery experience mirrors that of most transplant patients. The incredible thing about him is the speed at which he's gained that functionality. So, what about donors? One of the challenges of hand transplantation is that the hands not only have to fit immunologically, they also have to look right because they're going to be on view, an issue that doesn't arise with internal organs. That makes the job of finding an appropriate donor even harder. In any case, because hand transplantation is rather unusual, people have been slow to donate, and there have been occasions when surgeons had to ask for a donation when somebody's offered other organs, but not specifically the hands, and that's a really difficult thing to negotiate with next of kin at the time of death. The hand transplant program is now established and it's becoming mature. It'd be nice to think that hand transplants could become as routine as kidney transplants. Setting up a donor network is the next goal.